for medical science. Since 2018, after her master's in psychiatric in UKM, she took upon subspecialty in child and adolescent psychiatry and had advanced training in the respective field in University of Melbourne. She has also had many researchers in her hand and co-authored a couple of scientific publications and currently working on clinical guideline. So let's invite Dr. Nurul Wafa Hussain with warm welcome. Dr. Nurul Wafa.
Okay.
Can you kindly share your... Can you hear me, Dr. Wafa?
Yes, I can.
I think you can share your slide.
Can you all see the slide?
Yes.
All right. Thank you so much, Dr. Tawamala, for the kind introduction.
Welcome.
And thank you so much for the thank you so much, Malaysian Association of Pediatric Dentistry, for inviting me for this talk. Shall I start now?
Sure, doctor.
Okay, all right. So the topic that was given to me today is behavioral expectation and management of children with ASD and ADHD. I guess that this is very different from physical talk where I can see all the participants, but in this case I can only see my slides. Okay, so these are the contents of what I'm going to speak about. What is ASD and ADHD? The treatment of ASD and ADHD in general, challenges in oral health care, and the specific approach. Okay, what is ASD? So it is a neurodevelopmental disorder because some people may thought that it's a psychiatric disorder, but it's not. It has been there since even before the child was born. And it can be detected as early as 18 months of age. And it has two major symptoms. One is social communication skills problem, and another one is the odd behaviors that the children presented. And it's quite common, it's 1 in 100, and boys to girls ratio is 4:1. So it's more in boys rather than girls. So as you can see, ASD is a spectrum where you can see the classic ones, the ones with severe learning disability, the one in their own world. Most of the time, the classic one, they are non-verbal, and you can see that they are playing with their hands, they are very aloof, they don't know how to do things. And it can also be to the other end of the spectrum, which are those who look so normal to you, but some weirdness in their behavior. So these people, they are high functioning, they can go to the mainstream school, but friends may say that they know her, but she may not know your name because usually they prefer to be on their own, but they are highly intelligent. And in Malaysia, the government attempt to have early detection, and they can be detected as early as 18 months. Because of that, if you have a child, then in the development book, you can see that at the age of 18 months, as well as at the age of 3 years old, screening was done. And this is one of the KPI in the clinic kesihatan. However, sometimes if the parents are in denial, they would just answer yes to everything and may not be detected as well. And how to do this? You can see that they are bold, and the bold questions are the critical questions. So if you score 2 or more in the critical items, so meaning that there's high likelihood of your child to have ASD, and when their screen is positive, then these are the people who should be referred to pediatric clinic for further assessment. So as you can see that it has two major symptoms in which I will elaborate further. As in other diagnoses in psychiatry, we use DSM-5 because most of our diagnoses, they are made out of symptoms rather than the actual cause. It's not like TB when you have to have Mycobacterium tuberculosis to determine what is the cause. So in psychiatry, we have to look into all the symptoms and how to see whether the child has those symptoms or not. It has to be by the history from the family, by doing the observation on the child, and also by playing with the child, and to get more history from the school or the kindergarten or any caretakers that take charge in taking care of the child. So one of them is deficits in social emotional reciprocity. So this is something which is very subjective. How do we know that the child has problem with this? So in every communication, usually when we talk, it's about like like playing with badminton, that we someone serve and someone return. So it always has to be two-way communication. But you can see on speaking to child with ASD, if they are nonverbal, it's very difficult for you to talk to them. But if they are even verbal, you can see that sometimes you need to take extra effort to talk to them. Or when you talk to them as if there is a wall between you and the child. And secondly, the deficits in non-verbal communicative behavior. The most obvious thing is the eye contact. So you can see that they have very poor eye contact. They may not look at you. And sometimes, even if they look at you, they would just tilt their heads and look at you in a very different manner. Okay. And number three, there is deficits in developing, maintaining, and understanding relationship, where very difficult for them to make friends or even maintaining friendship. So that's why they are described as an aloof child, a child who likes to be on their own. Okay, and in order to make the diagnosis of ASD for these social communication symptoms, you have to fulfill all the three symptoms. And for the behavior part, you must at least have 2 out of these 4 symptoms. And what are the 4 symptoms that you must observe? One is the stereotype or the repetitive motor movement. So for example, like this child making hand gestures. And sometimes they don't really make these gestures, but when they are happy, they like to flapping the hands like that. And sometimes you can see when they are playing that they are arranging all the toys rather than playing with imaginative play. Yeah. Okay, and then they also have insistence of sameness and very inflexible. So for example, if there is always a route, for example, that this is the house and this is the school, so they always want to have same route every day to go to school. But if the route is different, so for example, if mom had to go to a shop, so maybe mom goes through here, they can get very agitated, very angry, because they insist they want to use the same route. Similar, like if they have a helper at home, and when the helper had to leave the household, they can get very, very agitated, and that's when they throw tantrums, and mom will have difficulty in managing their behavior. The other symptoms are they had highly restricted and fixated interest. This is when last year I have one patient. She is actually from MRSM Alogajah. She is very intelligent. However, friends find her very odd because she doesn't like K-pop, but she likes everything to do with the history of World War II. And she even likes the Germany anthems, and she even sang that to us. So I guess that she can't fix with other children because of this highly and fixated interest that they have. And sometimes the interest can be changeable. One day they can be very interested in dinosaur, and the other day they can just talk about alien and the outer space, you know. And the fourth one is the hyper or hyperactivity to sensory input, where their sensory can be very, very sensitive. So for example, okay, this is the restricted interest where this boy, he's very interested in dinosaur, and this teenager is very interested in anime and refused to talk anything to you about it. And this one particular boy, he likes, he's very, very creative. And the way he do with the plasticine, you can see the details of it. And most of the child, when they play with these toys, this is actually a bed where the child turn into a table, and this is actually a closet where the child turn into a trunk. Very creative of them. And when they have this hyper or hyperactivity to sensory, they may be very sensitive to sounds. And some children, they cannot tolerate fruits because of the smell. And even they have problem in terms of wanting to brush their teeth because the oral cavity can be too sensitive for them. And also the smell or the flavor of toothpaste can be very disturbing for them. So those are the criteria of ASD mentioned in the SM5. But there are also other associated symptoms like hyperactivity. Majority are hyperactive either because they have sensory seeking behavior, because you know that in our joints, we have proprioception. And some children, they want the proprioception to continually be in movements. So they are very, very active. But some, they have another illness called ADHD. The other associated symptoms is anxiety. And anxiety will be the main reason why the child refuses to go to school or refuse to go to the dental clinic. And 70% of them has low intellectual capacity. All right, and now I'm going to another disorder, which is called ADHD. And for ADHD, it's a persistent pattern of inattentiveness and or hyperactivity, impulsivity. So you can see that there are two components, inattention as well as hyperactivity, impulsivity. The examples of inattentiveness, they often make careless mistake. And when the teachers are teaching in front, the child may have difficulty in sustaining attention, so they are easily distractible. So whenever you have a child sitting next to a window, it can be very dangerous because usually they would just watch outside the window rather than watch or focus on the class. And often they does not seem to listen because they always have mind wandering. They like to daydream. And I'm sure that some of us, when listening to the talk, sometimes our mind can wander off as well. So most of us have some symptoms of inattentiveness, but ADHD is a diagnosis when your function is affected. And they also does not follow through on instruction. They fail to finish the homework. So asking them to do a task is going to be a very difficult task for them. They also have difficulty organizing tasks. So for example, like you ask them to wash dishes. If that's for the first time they're doing, they don't know where to start. So you have to teach them to do it in sequential manner. And also they often avoid or reluctant to engage in tasks. For example, if you ask them to do homework, it needs them to sustain a mental effort, and that can be quite difficult for them. So those are the symptoms of inattentiveness, and loses things also is part of the symptoms. this is established. This is especially true at in children who is in primary 1, because parents, they often check the child's bags, and usually they can find that those with ADHD, mom has to buy the color pencils or the stationeries every day because they kept losing all the things. And they are often easily distracted, and they are often forgetful because their minds is all over the place. So it's not because they are demented, but because they are just can't focus in doing or remembering things. Okay, so in order to make diagnosis of ADHD, you must have 6 out of all these 9 symptoms. And now I go to hyperactivity and impulsivity. This is quite obvious, especially when the child is in front of you. They fidgets, they can't sit still, they leave their seats, they run about, they climb. They are not afraid of danger. They may just walk across the busy street, and that can be very dangerous for them. But they are unable to play or engage in leisure activities quietly. So mom would say that they don't know how to play. They would just throw the toys. Or once you bought a toys, then suddenly all are being disassembled by them. Okay, they're often on the go. They talk excessively. They have lots of energy. They just blurt out answer without thinking. They have difficulty waiting for their turns, and also they like to interrupt the adults when adults are having conversation. Right, and the other associated symptoms of ADHD are they may have sensory problems as well, and they are prone to fall and have dental trauma. Actually, I on my own have a child with ADHD, and I remember that my child, when he was 2, one of my friends asked whether doesn't my child know how to walk, because he kept running and falling all the time. Right. So what about the treatment of ASD? So whenever we treat patients, we use the CPG, and these are available at the MOH website. So there are 2 ways of managing. We prefer the non-pharmacological and only give medication if needed. So among the non-pharmacological treatment, if they have speech problems, then we refer them to speech therapy. Occupational therapy plays a very important role because when they have problem with the sensory, so OT will help them with sensory integration therapy. And if they don't know how to make friends, so OT helps them with social skills training, behavior intention, as well as second. We also teach parents about parenting skills. But our challenges are parents, they're often in denial. They have difficulty to accept. So I always tell the parents, when I diagnose a child with ASD, we are not actually labeling the child, but we want the parents at least to understand and do the necessary, like sending the child to speech therapy and occupational therapy. And then we would discuss with the parents about what would be the best education, whether they need special needs school or they need inclusive school, which is the child being monitored in the mainstream, and they are monitored by the teachers from the special needs education, as well as whether the child is suitable to go to mainstream or not. I'm so sorry of the background sound. We have azan because the hospital is near the masjid. Right, so let's go to the pharmacological treatment of ASD. So these are the medication recommended according to our CPG guideline. We give medication only when the child has behavioral issues, anxiety symptoms, as well as sleep problem. Usually, I would tell the parents to look into their stress level. If they still can manage the child without medication, the means of treatment is therapy, therapy, and therapy, and a good school. But if they can't manage the parent stress level, they are very contagious. When the parents are stressed, the child may feel the stress as well, and they become more tantrums. So we do recommend medication. Risperidone, it is in tablet form, but it is also available in oral solution. But this is the item under quota. So only selected patients eligible to have this quota. Right. So those are treatment of ASD, and now let me go to the treatment for ADHD. So we use this CPG, but this is the first edition released in 2008, but currently we are doing the second edition, which will be coming out soon. And in terms of treatment, for the non-pharmacological, we refer to occupational therapy for them to do attention skills training. And most of the child, they also have scholastic skills problem. Even though they are actually quite a normal child, but some may have problem with their sensory, and they may hold the pencil, whether usually they would just press too hard or too light because of the sensory issues. So the occupational therapist will teach the child the correct way of using the pencils. Okay, and they will also do the fine motor skills. We also go to the schools and we teach the teachers on the classroom intervention, as well as doing the parent training, because parents have to know how to give orders, because you can't just give orders at one go, asking the child to do this, and this, because they can be quite forgetful. So you have to give them one task at a go. And all behaviors must have consequence. So if they become mischievous, then we have to teach the parents on how to give either punishment or positive reinforcement to the child. Okay, so this is the OT doing the training for the children. Right, and this is for the pharmacological treatment. Medication which is famous for it is Ritalin. So as you know, Ritalin is a stimulant. So in the pharmacy, they are under DDA, Dangerous Drug Act. So they have to be kept locked. And the names and address and all are being filled by the pharmacist if you were to prescribe Ritalin on the patient. It's a very good drug because it keeps the patient concentrated or quiet for at least 4 hours. So it's a plus minus. It works from 2 to 6 hours. So on average, patient would stay focused on medication for 4 hours. And we usually ask them to take it during school because we want them to focus in class. Okay, and they are also in the form of LA is long acting, can be up to 8 hours, and Concerta can be up to 12 hours. But Ritalin LA and Concerta both are the quota item. They're quite expensive, so limited patients only can be on them. When starting medication, I would tell the parents that the benefit will be the child will be quiet for 4 hours. They will focus, they will do homework. But during that 4 hours, they cannot sleep because it's a stimulant. So don't give them at night because we want them to be given during daytime. During that time also they have poor appetite. So if you want to give food, please give before medication or after medication. So take breakfast before you give the medication, and then after medication has wear off, after 4 hours, then patient can take their lunch as usual. But we as doctors will monitor the weight and the height for the children. And sometimes they can be emotionally more sensitive. So last time, if they have ADHD, their mind is always elsewhere. So even if the mother is scolding the patient, they may not realize mom is scolding. But if they are on medication, when mom scolds them, it goes through their heart. And sometimes they can be quite sensitive to the scoldings by mom. And other medications are a non-stimulant. If they cannot tolerate Ritalin because they are getting skinnier, or if they develop side effects, then we will give atomoxetine. Okay. And for these two types of children, what are the challenges in the oral health care? The challenges will vary with age, developmental level, and the severity of ASD. For high functioning, it may not be a problem because children with ASD, they like routine. So if you already teach them from beginning or from childhood that they need to brush their teeth, so this is something that they will do every day, every night. However, if they have tactile sensitivity at the oral cavity, then this can be very, very problematic because parents can hardly put anything, all right? And sometimes parents, they like to force the child to brush their teeth. And whenever the child refuses, they will force and scold. And this can cause traumatic experience to the child. So imagine that you are in the place of your child, being scolded for the things that you don't like to do. So sometimes this can be very traumatic, and each time the parents show the toothbrush, they already feel the anxiety in them. Okay, so how to go about with these challenges? So one of the skills that we'll teach the parents is to use desensitization technique, where you have to start with small thing. Just put a finger a little bit, okay, and see how the child responds to it. Okay, or even introduce the toothbrush. Just put on the hands to say that this is so safe, nothing to worry about. And maybe just put on the lips first, but you do it every day for 1 week, and then only put a little bit more deeper. So this is something for you to desensitize the child, rather than you put the toothbrush straight to the child's mouth, and the child can be very panicky. Okay, and when you want to teach, use calm and low tone voice. Give reward upon completion of the task, because I guess this is so different as compared to a normal child, because in normal child, if you scolded them, they would remember and they would try their best not to do the same thing again. But for child with ASD, you have to use different technique, more of reward system rather than punishment. And how much you are angry with them, you need to stay calm and low and use, even though you want to use a strict voice, that's okay, but in a very low tone. Okay, and these are the challenges for children with ADHD. One of the study in USA, they found that 48% of children with ADHD brush their teeth every morning. So about only half of the children, and half of them brush their teeth every evening. And another study showed that nearly 12 times the odds of having higher number of diseased, missing, and filled teeth. Why? Because mainly ADHD child, they forget to brush their teeth. And also they struggle to focus on the task. So how do you go about for ADHD? This is the rules: remind, and remind. Then, even though you have reminded, they may still forget. But if you give medication, sometimes it sticks for a short while. Yeah. And also when they struggle to focus on the task, so they wanted to do everything fast. So within minutes, finished. But it wouldn't make their teeth clean, right? So that's why you need to be with them and do it together with them, so they understand on how to do, because in terms of organizational skills also, they had problems with that. Okay, and you may want to give them star chart. So for the week 1, if you brush your teeth every day, every morning, so I would usually put the star into half. Half of the star in the morning, half of the star at night or in the evening. Then if 1 week you have all stars filled, then you may want to give them reward. But please don't give them reward the first week they do. Maybe you want to try with small reward, like give them an eraser or a sticker or a kiss. But if week 1, you've already given them something big, then week 2, week 3, maybe you ran out of idea on what else to give them, because these have to be continued. And some children, when they are already mastering the task, so sometimes you don't have to give every week, but you can tell them, okay, after you completed 6, then you can claim your rewards. This is something like our points for real rewards or other bank cards. The more we use, the more points we get. And then we can redeem. So we can do that to our children as well. All right. And these are the challenges for the children to go to the dental clinic, because I guess the big issues are the anxiety. Why they have anxiety? One is because of the unfamiliar place. They never been to that place before. So it's kind of give them palpitation, rasa takut, so scared, yeah. And then the fear of unknown or what to expect. They never been to any doctors before. And most of the people say that if you go to a doctor, then there will be a syringe, they will inject you. Or even the doctors will put a machines into your mouth. You know, so these are the things that they are fearful of. And then going to see a dentist. This is my own experience, that when I entered the room, only the staff nurse who greeted me, and then I was asked to sit on, and then I was being, the chair was being laid down. So when I saw the dentists are already in mask and face shield, so I don't actually know the face. And it's very different when you see them when you are lying as compared when you are sitting. So I guess that this is an experience of a normal adult. But what else if it is a child? It must be very, very scary for them. Yeah. And then the sounds of machine itself. Even if you wait outside the room, then you can see there are machines from another room. So these are the things. If the ASD child that very sensitive to sounds, then it may frighten them, or they really, really feel uncomfortable with it. And they may also have anxiety because of their past experience with other doctors, because other doctors may not understand them and may just touch them or may give them vaccination. And they may think that in dental clinic, they will be done the same as well. So for us, the first experience of a child in our clinic is very, very important, because it makes them feel at ease and they are okay to come back again to our clinic. So those are the challenges. And what are the specific approach that I usually prepare the parents? So before preparing the parents, I myself will try to identify whether does the child understand about emotion, because a child would just cry, but you don't know what's the emotion underlying a child. This is something that I learned when I went to Australia. in Australia, I learned about infant mental health. So imagine a baby, a newborn baby, they also have their own mental health. And this is something that I never think about until I went there and realized that babies also have emotions that we need to tackle. So that's why when the child comes to you, maybe 2.5 years or 3 years, sometimes maybe they don't know the words, but I will usually show them the emoticons and ask them, have they feel like this? What is the name of this feeling? And have you ever feel like this? So we start with the positive ones. Then only we go to the negative ones. Have you ever feel like this? What is it called? Most of them know that this is sad. Have you ever feel sad before? So some may answer that, yes, my mom made me sad because she scolded me. Something like that, right? This is anxious. This is unhappy. Some may show emoji of anger. And we also, whenever they feel anxious, we also want them to tell us how high is the anxiety level. So this is called anxiety or stress thermometer. So for example, in a hospital, we have pain score. So this is about the same. So if 10 is the most time when you feel anxious, that you really, really cry, you really, really scream. So on thinking about going to dentist, where are you? Okay. And then I would ask them, how's your stress level now? Okay. Because sometimes going to dentist is 8, but now it's 10. Because seeing doctors and doctors is asking them questions also give a stress to them. Yeah. Okay. And then we tell parents, we manage to identify the child's emotion. So mom has to practice this at home and always label the emotion whenever the child feeling sad, whenever the child feeling happy. So the mother should name or label the emotion to the child and tell the child, you look happy today. I can sense that you feel sad today. So the child knows that's how they are feeling. Yeah. So validate the emotion, because we want them to feel that all emotions are acceptable. You can feel sad, you can feel angry, and that is okay. Yeah. And if they feel overwhelmed, if the stress level about 5 or 6, then you can teach them on the relaxation strategy, right? Breathing exercise, or maybe they have their favorite toys, or even kids, they have bata busu or favorite teddy bear, okay? Or they can even use sensory tools, anything that makes them calm. Because some child, when they feel so anxious, mom need to put a weighted blanket on top of them, on their laps, to make them feel calmer. Yeah, and these sensory tools will be taught to them by the occupational therapist. Okay, and we also prepare the child using social storybook, because when the child know what to expect, the anxiety level will reduce. Okay, so this is how we can using this card to teach them on the breathing exercise. Okay, for example, like for this dragon, imagine that you are a dragon. Close your eyes and slowly inhale through your nose for 4 seconds. 1, 2, 3, 4. Hold 3 seconds. 1, 2, 3. And then pretend to breathe fire out of your mouth as you exhale a huge roar for 6 seconds. Woo! Okay, so that's the exhaling part. Yeah, so the child will love to do it, and they can remember when you teach a strategy like this to them. This is for the breathing exercise. So when the child already know on how to do it, so it's easier for mom to tell them, okay, doctors, if the patient is anxious, can you allow the child to do some breathing exercise, and the child know how to do it. Yeah, or you can teach them snake breath. So these are all available when you Google them, or even unicorn breathing. So that depends on the child if they like unicorn. So this is something that you can try. Okay, right. So this is an example of social storybook. Right, to tell the child what you should do or what to expect when they arrive at the dental clinic. But this is the Western, because you can see, first, hang up clothes. Malaysia don't wear clothes, right? But maybe you can replace it with make sure that you wear a mask. Then you have to be in the waiting room, sit in the dentist chair, put on sunglasses, open wide your mouth, and the doctors will count your teeth. I'm not sure whether the doctors here does all this, but I'm sure the nurses, they teach the children to brush the teeth, rinse the mouth, and then some clinics, they do give prizes or rewards to the children after such visits are completed. And this is another way of doing social story as well, where we teach the parents, maybe you can take a picture of the clinic kesihatan or even the kids dental clinic in a hospital, but ask permission from the nurses or the receptionist that you want to take photos, so that you can prepare the child to go to the clinic. Yeah, and teach them one by one what to expect, where you sit, and look at the friendly face of the doctor or the nurse. Okay, and this is where the chair you're going to sit. Okay, and it's good for the dentist or the nurse to not wearing mask when they first come. But I'm not sure, because of the SOP now, everyone wear mask. So maybe that this is probably something that cannot be done during this COVID period. Okay, and you may want to make them see these are the tools, and then you have to open your mouth and etc. etc. Okay, for this clinic, they have lots of rewards or prizes that the children can choose, which is good. I remember when I was a medical student that I went to UKM faculty, where I did my usually have blood score, and I'm so lucky that I got the good blood score, and they did the prize for me is for the whitening of my teeth, and I'm so happy after that. So I can imagine that children are happy as well. Okay. And if the child on medication, advise to take medication prior to go to the dental clinic, because at least it reduces a little bit of their anxiety. And if they are hyperactivity, because you can imagine they are fidgeting, they like to touch this and that. So by having the medication, they're a little bit quieter and they can focus on whatever that's being done on them. Even when the doctors ask them to open their mouth, their mind is there. They can try to make the doctor happy by opening widely the mouth. Yeah. So these are the advice that can give to the parents or children. Okay. Some children, they are very, very unpredictable. Sometimes parents have prepared them good words about dental clinic, but when they went there, things can get worked out. They can get very anxious. They can scream, the guling-guling, but then the parents may not know what to do. So some centers, they have what we call a calm space. And do you know where this is? So this is actually at Sunway Mall, Putra. Sunway Mall, Putra, they have Autism Day, if I'm not mistaken, either every Tuesday or every Wednesday, when they do, in terms of announcement, they reduce the tone, they dim a little bit of the light, and they make the space autistic friendly space for the children. Yeah, so when the child gets woke up, they are allowed to go to the calm space or the calm room. And even KLIA2, they have also another calm room. So this is in KLIA2. Some people call it Snoozland room, but Snoozland, they are registered trademark. To have Snoozland room, so you know that you must have a proper equipment according to the Snoozland standard. And do you know how much this costs? It's not cheap. Yeah, it costs thousands of ringgit. I can't remember whether it's about 30,000 just to get this. Yeah. Okay, or it doesn't have to be a room. It can be just a space, yeah, for the child to calm down. Because when the child are throwing tantrums, it's not easy for mom to calm them down. Sometimes you need to give them space so they calm down on their own. Okay, so I guess that's all for my presentation. And before I off my presentation, so I would like to make the announcement of the oncoming webinar for July. Maybe Dr. Mala, you want to tell more about this?
I will do, Dr. Wafa. And thank you very much, Dr. Wafa, Nurul Wafa Hussain, for the very enlightening talk. It was a great overview and very informative, especially what you expect from these kids, you know. You have covered it well. And I agree with you, the part where at the current situation with us being in full PPE, it'll be a great disadvantage for kids with ADHD and ASD, you know, when they see us in full mask and PPE. Let me see if there are any questions for you. I guess there at the moment there are no questions. I think you have covered very well, and it was a very interesting topic. Just one question from me, Dr. Wafa. If in the event that for diagnosis of ASD or ADHD, who require the? I mean, we need whose confirmation or verification, whether it's child psychiatrist verification or PEDS medical verification, or even an officer from KIA to confirm that child is ADHD or ASD.
Okay, so actually any doctors can make the diagnosis as long as they are confident in doing it. So if they are not confident, they can refer. If under 5 years old, preferably to refer to pediatrician. But above 5 years, because why pediatrician? Because we're afraid that patient may have associated medical condition that psychiatrists may miss. But above 5, if they are not sure, then they can come to us. Yep.
Okay. All right. Thank you very much. Because we do have children where, as you say, parents are in denial, and they're not sure, and above 4 or 5, and they're not sure whether the child has learning difficulty or ADHD or ASD. So most of the time we refer to the PEDS medical, and I'm glad to know that psychiatric also can do evaluation. Thank you so much, Dr. Nurul Wafa, for your time.
Okay, you're welcome.
And the talk today. I think there are no questions, and I'm very glad to have you here, and hope to have you with MAPD in future as well. And for the participants, as Dr.
For organizing this.
All right. Thank you for having you today. Have a nice day. And for the participants, our next webinar, bye, Doctor. Our next webinar will be on aversion, complications and management on 14th of July, if I'm not mistaken. I hope to see you all, and the updates will be posted in MAPD Facebook for you to look out to keep up as well. Thank you so much to all the participants, and kindly for the attendance, the link has been posted in the chat group. Kindly click onto the link and to get the attendance. Thank you so much, everyone. Have a nice day and see you all on next webinar.